Job numbers, they are up. Illegal border crossings are down. Democratic Congressman Scott Peters standing by. He'll discuss that and a lot more when we come back. Joining us now, Democratic Congressman Scott Peters. He's on the Energy and Commerce Committee, which approved legislation in the GOP's health care bill yesterday. We're going to get to that in a moment. But does the president deserve credit for these good jobs and numbers in February?
Well, I'm sure he'll claim it's a wonderful picture that he painted, but really I think we're all interested is can he implement those growth policies that he talked about? That's what I think people are optimistic about, to the extent they're optimistic. Let's work together and do tax reform and infrastructure and keep it going.
Because the markets have been impressive since his election on November 8th. The Dow Jones is going up. The S&P is going up. There seems to be a lot of confidence in potential policies he's going to try to push through.
Right, and there's a lot of optimism that in a new administration we'll get a lot done, and certainly I'm ready to work with him on those job-creating growth strategies. Just a matter of time to see whether he can actually accomplish that.
You're ready to work in terms of a $1 trillion infrastructure piece of legislation. A lot of Democrats would love that. Well,
I think a lot of Americans would love the jobs it would create and the things it would do for trade.
That's an area where there can be.
A lot of overlap.
What about tax cuts?
I think tax reform is something that we want. We know that we're uncompetitive internationally. We know that we have a lot of money stranded overseas. A lot of Democrats like me want to work with him on that too.
Because he wants to reduce the corporate tax rate from 35% maybe down to 20%. Are you with him on that?
Possibly. You have to get rid of a lot of the loopholes and the the deductions. And we've been talking about streamlining that for a long time. I'm ready to go.
On health care, you see their effort to repeal and replace Obamacare. The Democrats, I think, uniformly oppose all of this. You're among the Democrats. You oppose it, right?
Absolutely. It was a terrible. We sat through a 27-hour hearing this week, and we hardly did anything to help the health care situation. Look, there's two things that we talked about. A lot of Republicans told stories about increased premiums. Democrats told stories about people who are relying on health care to take care of their families, their kids, and it's brought a lot of coverage to a lot of people. The deal that they propose is estimated now by Standard & Poor's, which is not a left-wing organization, a Wall Street organization, throw 10 million people off coverage. Brookings Institution, a nonpartisan think tank, 15 million estimated off coverage. Plus, we just saw the Molina Healthcare CEO say that we're going to see the individual market, the prices in the individual market rise by 30% because there's no incentive for the young people, less incentive for young, healthy people to get into the pool.
Well, the Congressional Budget Office, the CBO, they're supposed to come out with their estimate on Monday, but you already hear officials at the White House saying, look, their numbers have been way wrong in the past. You've heard some of the Republican leaders in the House say their numbers. Don't waste your time looking at that CBO. Your reaction?
Yeah, well, think about what you just said. We could have waited till Monday to hear what the Congressional Budget Office said about what this is going to cost the American taxpayer and who it's going to cover and who it's not going to cover. That was information we could have had waiting just until this Monday, but we had to ram this through on a bill that was declassified basically on Monday. It got no hearings, and so the notion that there's some sort of bipartisan effort, I think that's out the window. But the real issue is that people haven't had a chance to look at this and really talk about it, really address what we should be doing to fix where the healthcare system needs help. And we're just rushing through with this thing, which the more and more we learn about it, opposition from doctors, the American Medical Association, the Hospital Association, AARP, speaking up for seniors, Catholic Charities, nobody seems to like this.
You think it can pass?
That's up to the Republicans. It won't get any Democratic votes, although many of us would like to fix the problems in the existing healthcare system. We want to make the system better. I don't know.
Was there any outreach to Democrats at all in coming up with this legislation?
Zero. And the justification for that is that that's what happened in 2009. But that's the
when Obamacare was introduced.
Yeah, but if your kids...
It was passed strictly among the Democrats.
Yeah, that's fine. 60% of Congress, almost 57% of Congress wasn't here then. We're all new. But that's also, that's the kind of justification for bad behavior that you hear from your child when they say, well, he started it. American people deserve better than that. They deserve a bipartisan approach that's open, that looks for real solutions. And we didn't get it this week, and it doesn't look like we're going to get it on the House floor.
Scott Peters, a Democrat from California, thanks very much for coming in.
Well, appreciate it.